Risk factors in depression. Risk factors increase the likelihood of developing an illness. In terms of depression, there are several risk factors that may be involved, including genetic, psychological or environmental causes. Genetics and family history. Genetics play a significant role in depression. If you have a close relative such as a parent or sibling with depression, you have a 2 to 3 times higher risk of developing the illness compared to people without close relatives with depression. To prove this, researchers have studied depression in twins. If identical twins, monozygotic or univitelline, have 100% identical genes, the rest of the twin pairs, dizygotic, are similar in only 50% of the genes. Therefore, if one twin has depression, the identical twin has a higher risk of developing the disease than the non-identical twin. Similar studies have found that the degree of inheritance of depression is about 40 to 50%. Chronic stress. If low levels of stress keep us motivated, prolonged exposure to stress can lead to depression. Prolonged exposure to stress leads to stimulation of HPA axis activity, i.e. the interaction between the hypothalamus, pituitary gland and adrenal glands. The HPA axis is vital to how the human body reacts to stress. Stimulation of the HPA axis leads to increased production of epinephrine, adrenaline, a hormone involved in the fight, flight or freeze response, and cortisol, also called the stress hormone, both of which can cause health problems, including depression. Existing data show that abnormalities of the HPA axis occur in 70% of people with depression. Trauma. People who have experienced abuse or trauma, especially in childhood, have a higher risk of depression. These people may also have drug-resistant depression once they become adults. Existing studies show that 62.5% of depressed people have had at least 2 traumatic events compared to the control group where the percentage was 28.4%. Furthermore, people suffering from depression are at a much higher risk of emotional, physical and sexual abuse, were neglected as children or harassed by friends or schoolmates, or witnessed domestic violence. Gender. Women have twice the risk of depression than men. Researchers concluded that women are more stressed and have a higher risk of trauma than men. Moreover, it seems that the female hormone estrogen plays a significant role. Rates of depressive episodes begin to distinguish themselves in adolescence, when young women are more likely to experience depression. Women are also at greater risk of depression during menstruation or after childbirth, when hormone levels fluctuate. An unhealthy diet. Providing the necessary nutrients ensures normal brain function. Without some nutrients, there is a higher risk of physical or mental disorders, including depression. Evidence shows that processed foods can increase the risk of depression, and high carbohydrate consumption is associated with specific symptoms of depression in women. Studies also show that people with depression are more likely to be deficient in vitamin B9, B12, D, zinc, copper, manganese. A balanced and varied diet offers protection against depression. In particular, omega-3 fatty acids found in fish, seaweed, nuts and chia seeds are helpful. Certain personality traits. Doctors say that certain traits increase the likelihood of developing depression. These include a high level of neuroticism, a low level of cooperation, excessive avoidance of seemingly dangerous situations, a high level of introversion, a high level of insecurity, constant feeling of stress, frequent mood swings, feeling tired after social interactions, disorganization, impulsiveness, finishing things at the last minute. Treatment of depression. Most doctors say that antidepressants should not be the first form of treatment for mild depression because the risk/benefit ratio is low. In general, the following treatments are recommended: lifestyle modification, psychotherapy, cognitive behavioral therapy, and then treatment with antidepressants or other drugs. There is evidence that collaborative care of the depressed patient by a team of specialists gives better results than consulting a single specialist. Lifestyle modification. Exercise helps to moderately reduce symptoms in mild depression. However, for older people, exercise does not reduce depression. The main problem with exercise in depression is that people need to be willing, motivated, and healthy enough to participate regularly in physical activity. A healthy, balanced, and varied diet helps to relieve symptoms in mild cases of depression. Similarly with sleeping 8 to 9 hours a night. Observational studies also show that smoking cessation has similar benefits to taking medication. Psychotherapy or talk therapy can help relieve some of the symptoms associated with depression, especially in the case of a distorted view of the world. For mild forms of depression, lifestyle changes and psychotherapy are sufficient, while for complex and/or chronic forms a combination of medication and psychotherapy is needed. There is even evidence that psychotherapy can be a short-term remedy for drug-resistant depression. It offers good results regardless of the age of the person. Cognitive behavioral therapy. Cognitive behavioral therapy is another form of treatment for depression, with the best results in children and adolescents. According to the organizations, in the case of minors, antidepressant medication must be combined with cognitive behavioral therapy, interpersonal therapy, or family therapy. Cognitive behavioral therapy aims to change self-destructive thinking and behavior. This form of therapy is based on the idea that thoughts influence our behavior and that changing them also helps to change behavior. Unlike psychotherapy, cognitive behavioral therapy has shown positive results even in cases of moderate or severe depression. Cognitive behavioral therapy also helps prevent relapse. Drug treatment. The most commonly used drugs to treat depression are antidepressants. In general, medication is recommended for severe and chronic depression. An analysis by the UK's National Institute for Health and Care Excellence found that selective serotonin reuptake inhibitors, SSRIs, are more effective than a placebo in cases of moderate and severe depression. For effective treatment, doses are adjusted and even combinations of different classes of antidepressants are tried. Adverse reactions to antidepressants occur in 50 to 75% of cases, and it can take up to 8 months for symptoms to improve. Treatment is usually continued for a further 16 to 20 weeks after symptoms have subsided to reduce the risk of recurrence. The risk of suicide in those taking SSRIs varies. For example, in young people aged 18 to 24, there is a higher risk of suicidal risk. In adults, it is not known whether SSRI drugs affect the suicide rate. Some studies have found a link, while others have found no risk. Herbal remedies, sunflower and substances extracted from it may help relieve symptoms of depression, having effects similar to mild antidepressants. Basil leaves also contain camphor and volatile oils and can be used to alleviate mild depression. Although there is no scientific evidence, some spices are said to stimulate a better mood. These include cinnamon, saffron, ginger, vanilla, and nutmeg. These are thought to help release feel-good endorphins. Prognosis. Episodes of depression resolve over time, whether or not they are treated. People who are not admitted to psychiatric hospitals have a 20% reduction in symptoms after a few months. In general, a severe episode of depression lasts about 23 months, and after about 3 months recovery begins. Existing data show that 80% of people who have a depressive episode will suffer at least one more during their lifetime, with an average of 4 episodes in a lifetime. Other research shows that 50% of people recover from depression with or without treatment. The remaining 50% will have at least one more depressive episode. Of these, 15% will also suffer from chronic depression. Some studies show that inpatients have a lower rate of recovery and a higher rate of chronicity compared to outpatients, who take medication, participate in therapy, and still have contact with the people in their lives. For outpatients, the average depressive episode lasts 11 months. However, 90% of people with severe or psychotic depression will suffer further episodes. Of those who have an alleviation of depression, there will still be at least one unresolved symptom after treatment ends. Although earlier studies indicated a 15% risk of suicide for people with depression, recent US data show that the risk of suicide is 7% for men and 1% for women. These percentages apply to outpatients and not inpatients. Results also appear in the context of the combination of medication, psychotherapy and social integration, a stable job and positive relationships with family and friends. Although depression is one of the most common conditions facing modern society, fortunately it is a treatable condition, but it is important that specialist medical help is sought in good time so that the condition does not worsen. Take care of yourself. If you liked it, don't forget to subscribe to my YouTube channel.